So I ran into a problem with a tooth. I got an abscess down at the root level, and there was a root canal that was done by a former dentist that continued to be a problem for me. And Dr. Despain did an extraction of that tooth, but it had got into another tooth adjacent to that. Once we got down to where I had two teeth adjacent to each other, I'd asked about something to fill that gap. I'm not a big fan of bridges. I've got family members who had bridges, and they're maintenance issues. And we had talked about an implant. Talking with Dr. Despain, it was, again, a one-stop shop. He was able to go in, do the prep work, put the implant in, mapped out the mouth, and printed a tooth. Within a couple of weeks, I was starting to use it and chew on food. And now I don't even know that I have an implant. I just use it like I did the rest of my teeth. In fact, I'm getting set up to have another one put in shortly after the first year to fill a gap that I have from an extraction years ago, like 40 years ago. I want to get that gap filled now. One of the reasons I'm getting the one that I want next year is the gap that I have from the one extraction on the bottom is not a real good candidate for an implant. So I have this kind of an overlap gap. So yes, I still use that side of my mouth, but I can't use it as efficiently as I can the other side. So by putting an implant in that gap that's there from years ago, that'll realign the teeth where I can go back to normal eating.